Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at the osteology of ribs. So at the end of this video, you should be able to classify ribs into the typical, the atypical, true, false, and floating ribs. You should be able to identify and describe the key anatomical features of a typical rib. That's the head, the neck, the tubercle, the angle, the costal groove. You should be able to differentiate unique features of atypical ribs as the first, second, 10th, 11th, and 12th rib. You should be able to explain the articulations of ribs with the vertebrae and the sternum. You should be able to apply the knowledge of ribs anatomy to interpret clinical conditions like rib fractures and cervical rib. Now let's start. The ribs are 12 pair of curved flat bones. Take note, they are flat bones that form the lateral wall of the thoracic cage. Now if you look at this image, you see these are the ribs in blue. The structures in blue are the ribs, while these are the costal cartilages and this is the sternum. So in this video we are looking at the anatomy of the ribs, the osteology of the ribs. So they have several functions. They protect the thoracic and upper abdominal organs, because in the thoracic cage you have the heart, you have the lungs, and in the abdominal region you have the liver, you have the spleen. These structures have been protected by the ribs. It provides attachment for respiratory muscles like the intercostal muscles, which are found in between the ribs and the diaphragm. It assists in mechanics of breathing. In the mechanics of breathing, you have the bucket handle and the pump handle movements. So now let's look at the classification of ribs. Now ribs, we'll look at the types, we'll look at the pairs, and what are the major descriptions. We have true ribs, we have false ribs, and we have floating ribs. Now the true ribs are rib 1 to 7. Rib 1 down to 7, we call them the true ribs, because they have a direct attachment to the sternum through their costal cartilage. They have their own costal cartilage which they attach to the sternum. That's rib 1 to rib 7. This is 1, 2, 3, 4, 5, 6, 7. They have their costal cartilage attaching to the sternum. While for false ribs, that's rib 8 to 10, they attach to the sternum indirectly, not directly, through the costal cartilage of the 7th rib. You see that rib 8 attaches to the costal cartilage of the 7th rib. Let's go here. Rib 8 attaches to the costal cartilage of the 7th rib. Rib 9 follows that of the 7th rib. Same thing with the 10th rib, attaches to the costal cartilage of the 7th rib. So they are attached to the sternum through the costal cartilage of the rib above. While we have floating ribs, that's the 11th and 12th rib, they have no anterior attachment. They end in the posterior abdominal muscles. These are the floating ribs, rib 11 and rib 12. They don't have anterior attachments. While there's another alternative classification of ribs, where we have the typical ribs, which is rib 3 to 9, and we have the atypical ribs, which is the rib 1, rib 2, rib 10, rib 11, and rib 12. Now, why do we call them typical ribs? They have common structural features. They share a common structural feature. Anything you see on this one, you find it on the next one. That means rib 3, 4, 5, 6, 7, 8, 9 have common structural features. While for atypical ribs, we have rib 1, 2, 10, 11, 12, which they have unique features. You can find one in this and not find one in the other. Now let's look at typical ribs. Now the typical ribs, they have the following parts. They have a posterior end, which is the vertebral end. They have, this is the posterior end, which is the vertebral end. They have an anterior end, and they also have a shaft. This is the shaft, and this is the anterior end, while this is the posterior end. So let's start with the posterior end. The posterior end has a head that is wedge shaped. It is wedge shaped and bears 2 articular facets. Look at the head. Take a closer look at the head. It is wedge shaped and bears articular facets. 2, one on the top, one below. There are 2 articular facets or demi-facets for articulation with the body of its own vertebrae. That's the superior facet attaches with the body of its own vertebrae, while the inferior facet attached with the body of the vertebrae above. What does that mean? if you're talking about the sixth rib, the superior facet of the sixth rib is going to attach to the numerically corresponding vertebrae, that's the sixth thoracic vertebrae, while for the inferior facet is going to attach to the body of the vertebrae that is above, that is in this case the fifth vertebrae. So it is separated by a crest of the head. You have the crest of the head, this is the crest, which means the two articular facets are separated by the crest. Now ribs also have neck at the posterior end, which is the constricted part beyond the head. This is the neck of the ribs. We also have a tubercle, which is a bony elevation with two parts. It has an articular part, it has a non-articular part. Now this articular part is smooth. Please take note of that. Take note of that. The articular part of the tubercle is smooth, while the non-articular part is rough. The articular part has a facet for the transverse process of the same vertebrae, sixth rib, sixth thoracic vertebrae, while the non-articular part attaches to what? Has ligament attachment. It attaches to ligaments. So this is the tubercle. It has a non-articular part that is rough and has an articular part that is smooth and has a facet. Now let's look at the shaft. The shaft, at the body of the ribs, we have an angle. We are still looking at the typical ribs. We have an angle, we have a costal groove, we have surfaces, we have borders. Now for the angle, it's a sharp bend laterally, a site where ribs change direction. Now if you look at these ribs, you see this is the angle of the ribs. It's a sharp bend, a part where the ribs change direction. Site of attachment for the levator costae and the intercostalis muscle. We have the costal groove, which is a deep groove on the internal surface. Remember, it's on the internal surface of the lower border of the ribs. The costal groove, this is our costal groove. See it here. This is our costal groove on the inside, on the internal aspect of the ribs, which is contains intercostal neurovascular bundles. We have the vein, we have the artery, we have the nerve from superior to inferior. That's how the intercostal neurovascular bundle are arranged in the costal groove. From superior to inferior, we have the vein, we have the artery, we have the nerve. So you can take the mnemonic VAN to remember that. Now the ribs, the shaft of the ribs have surfaces. We have an external surface which is smooth and faces outwards, and an internal surface that is concave and faces inwards. The lungs lie against the internal surface. We have borders, the superior border and an inferior border. The superior border is round and smooth, as you can see here. The superior border is round and it's smooth, while the inferior border, it is sharp and contains the costal groove. This is the inferior border. It is sharp and contains our costal groove. So we have an anterior end which is cup-shaped, has a cup-shaped depression for the costal cartilage, which are hyaline cartilages. And the cartilage now connects to the sternum. So the anterior end of the ribs, it is cup-shaped. This is the anterior end of the ribs, attaches to the costal cartilage at this part. Has a cup-shaped part that attaches to this costal cartilage, which the costal cartilage now attaches to the what? The sternum. That's that about the body and the anterior end. Now let's look at atypical ribs. These are ribs that have unique features. We said it is the first, the second, the 10th, the 11th and 12th rib. The first rib is the shortest, broadest and most curved. It has a single facet on the head, unlike typical ribs that have two articular faces on the head. For the first rib, it has a single facet because it does not have a corresponding thoracic vertebrae above. Do you understand? So it articulates only with T1. It has a scalene tubercle for attachment with the scalenus anterior muscle. It also has grooves for subclavian vessels. If you look at it, these are the groove. This is the groove for the subclavian vessel, as you can see here. It also has a scalene tubercle on the first rib that is for attachment of the scalenus anterior muscle. Now the second atypical rib, is the second rib, which is longer than the first. It has a tuberosity for serratus anterior muscle. It has a tuberosity for attachment of the anterior serratus anterior muscle. That's for the second rib. For the 10th rib, it has a single facet on its head which attaches only to the 10th thoracic vertebrae, while the 11th and 12th ribs, these are the 11th and 12th rib, they look alike. They have no neck and no tubercle, and they also have a single facet on the head, while the 11th has a slight angle. The 12th rib does not have an angle at all. That's the difference between the 11th and the 12th rib. Now let's look at clinical correlates about ribs. You can have rib fractures. This is common at the angle. The angle of the rib is the weakest point of the rib and is the most commonly fractured part. We have the middle of the ribs, which is from rib 4 to rib 9. This is the most frequently fractured and least protected. These are rib fractures. It can be a fracture at the angle of the ribs, and it has a lot of danger attached to it. The sharp fragments may lacerate the intercostal vessels and cause a hemothorax, or may affect the lungs and cause a pneumothorax. A pneumothorax means air in the lungs, while a hemothorax means blood in the lungs. We have flail chest, which is multiple fractures, about more than three fractures at more than 2 places. This is a multiple fracture of the ribs. It causes paradoxical movement, what we call flail segment moves inward on inspiration and outwards on expiration, which means when you take in air, the flail part moves inward. When you take out air, it moves outward. This is not a normal. Normally, when you take in air, it's supposed to move outward, and you take out air, it's supposed to move inward. So that is why it is called a paradoxical movement. That is flail chest. So now moving forward, we have cervical ribs. For cervical ribs, there are supernumerary ribs arising from the 7th vertebrae. They may compress the lower trunk of the brachial plexus as well as the subclavian artery. Remember, we said the first rib has a groove for the subclavian artery. So whenever there's another rib, a supernumerary rib that attaches above, that's the 7th cervical vertebrae, you're going to have compression of the subclavian artery as well as the lower trunk of the brachial plexus, and I have what you call the thoracic outlet syndrome. There's going to be pain, ischemia, paresthesia due to affectation of the nerves and the arteries. These are cervical ribs. This is an extra rib. This is the normal first rib here. This is the cervical rib. So you might compress the subclavian artery as well as the lower trunk of the brachial plexus. You can also have costal cartilage calcification, which is a calcification of the costal cartilage of the ribs. This occurs with increase in age. It is visible on chest x-rays and may mimic fractures of ribs, but it is benign. So this is a study tip. When you go to the lab for dissection, or if you have a 3D anatomy app, take a rib, look at it, trace from the head to the neck, to the tubercle, to the angle, to the shaft, the costal groove, and to the anterior end. Feel every part of this. That's how you remember your anatomy of the ribs. Thanks for watching. Don't forget to like, share, and subscribe to Alacrity Explains Anatomy, and turn on the notification button so that whenever we post a video, you'll be notified. Thank you.